Good evening, my viewers. Welcome again to our health segment, Health Matters on Siloam TV. We are very glad to have you on our show. Tonight, we have a very interesting daktari with us. Tonight, we are talking about eye matters, and I know we are going to learn so much as we go through the program. With me is one of our doctors from MERU Level 5 Hospital, who's an eye doctor. I'll welcome him to greet us. Karibu, daktari.
Thank you. My name is Dr. Mpekethu Mingaine. I am an ophthalmologist. I think I'll explain what that means in due course. I've been working in MERU for almost 15 years now.
Oh, really?
Yes.
Wow.
Yes.
Karibu sana daktari. And now that you said you're an ophthalmologist, those names, the eye doctors' names, they are very confusing. Can you tell us more about them so that at least we have an understanding? There is that one, there is another one. I mean, just tell us. I might confuse them more if I start talking about them. Clarify them for us.
Yes. When it comes to eye matters, most people know about opticians.
Yes.
But they are different.
Yes.
Now, let me talk about the ones you are more likely to meet in the hospital. We have the senior most is usually the ophthalmologist. That is a medical doctor who has finished medical training, which usually takes around 6 years.
Yes.
And then he has done a master's degree, which takes at least 3 years in ophthalmology.
Yes.
That is the study of eyes, eye diseases, and anything to do with eyes.
Yes.
And an ophthalmologist is somebody who has been trained to do operations, to give medicines, and to give glasses, or any other correction related to eyes. So it's like everything. He can do everything, or he'll be able to handle everything. Then we have another cadre within the hospital, that is the ophthalmic clinic officer. He is a clinic officer who has gone back for around 1.5 years training in ophthalmology.
Yes.
So they are also allowed to give medicine. They do surgeries also, and they also give glasses. So we almost do the same things, but generally they consult us where they are stuck.
Okay.
Then we have the ophthalmic nurse. The ophthalmic nurse is not a clinician. So nurses are generally more targeted towards helping the patient and supporting the clinician in whatever he's doing.
Yes.
So they are the ones who will help us with the clinic. They will they will handle the patient in the wards. They will help in theater. You cannot do an operation without a nurse.
Oh,
so
really?
they are very important. So the three cadres in the hospital work together. It's not a hierarchy as much as collaboration.
Yes.
Then there is now the optician side. Actually, there are 2 cadres in that area also. Most hospitals in the government sector do not have those 2 cadres working in within the government yet, but with time they will. And it's because most government hospitals do not give glasses.
Oh, okay.
Though MERU, with collaboration with the Kenya Society for the Blind, has started a bit. So the senior most in the optician side of things is called an optometrist.
Wow.
An optometrist is actually a degree holder. There's a Bachelor of Science in Optometry being offered at Masinde Muliro University. So I think the only university so far which is offering that degree, 4-year degree. Is not a doctor, so he's not allowed to prescribe medicine, but he can diagnose many eye conditions and refer to a doctor.
Wow.
But his main work is treatment of what we call refractive errors or conditions which need to be corrected using glasses or using contact lenses. That is his main work.
Yes.
And that is a big part. It's like the way we say, we have a doctor and you have a pharmacist. A pharmacist will treat using medicine, but he will have to be guided by the doctor which medicine to give.
Okay.
Yes. So that means the doctor will be able to know which drug to give. He will have studied about the side effects and everything, but the actual prescription will be covered by the pharmacist. So there is still some collaboration between the two. Yes, so we have the optometrist as the senior most in the optical or optician class, and he cannot do surgery, he cannot give medicine.
Okay.
Yes, but he can give glasses. He can give contact lenses.
Okay.
Then we have an optical technologist or optical technician. Technician and technologist, those are terms which differ in qualifications. Sometimes a technician is somebody that certificate course, technologist with a diploma, but they are really interchangeable. Okay. And that is now the person who actually makes the spectacles. So if an optician, optometrist, or even an ophthalmologist writes a prescription, the person will cut the lenses into the frames you choose is the optical technologist or the optical technician. Okay. Yes. Most of those courses are offered at KMTC. They train diploma holders in optical technology, and they can also work almost the same things optometrists do. Yes. Because as you notice in our educational system, there is a degree system, which is a bit superior, and the diploma system. So in almost all of these, we have those two. Yes. Yes. So there are some other colleges which are training optical technicians, maybe a 1-year course, and they are the ones who cut the glasses, fix them, they do all that. Yes. And we also need them, because I write a prescription, you need this kind of glasses, but I'm not going to cut and do that. So generally, you have to work with everybody. You need everybody. Okay. Yes. Now, I've always wondered, when, like, for us, when I get an eye problem, is it right for me to go to like a shop where I'm seeing specs being given for treatment? Is it right? I would also give the same example using any other disease. Yes. If you are sick, you don't go to a chemist as the first point. You first go to a doctor or a hospital. Yes. If the doctor needs to do a test, he'll send you to the lab. Yes. And then when he has made a diagnosis, he'll send you to a chemist. Yes. So to walk to an optical shop when you are sick is like walking to a chemist, which means you are walking to somebody who will only treat you in one modality. Yes. If that is not the treatment you need, then you'll have to be sent somewhere else. Yes. Or as happens, unfortunately, in our setting, they try to treat you with whatever they have, which may be the wrong thing. Just like you may walk to a chemist, you say you have a headache, they give you malaria drugs because they want to sell, while maybe you had something else. But the doctor is the one trained to actually offer all the treatments available. Yes. And now, since you have avoided him, you have just limited yourself to what that other person will offer. Which will be what is in his interest. Yes. If you go to an optician, maybe he'll give you glasses when you didn't even need them. Or when you had a more serious condition. Or maybe you needed the glasses, but you had something else that he couldn't handle, so you concentrate on what he does. Yes, so we always recommend the first stop when you are sick is to the clinician or the doctor, or just at least in a hospital setting, that's the first person you see. Yes, even a government hospital or any other hospital, you can't walk to the chemist. Yes, you can't go to the pharmacy. You have to first go to the consultation room, then you are sent to the lab. Yes. But the common thing we do here, because we don't want to spend money or we don't want to spend time queuing to see a doctor, is to get sick. Oh, I think I have malaria or whatever else. You rush to a lab, you have your blood tested, urine. The lab person may tell you, oh, you have a blood infection. Go to the chemist and buy a drug. You go to the chemist and the person in the lab, in the pharmacy tells you, oh, this is your lab result. Oh, use this drug, even antibiotic. And that is very wrong, because even a pharmacist should never give an antibiotic without a doctor having given a prescription. But here, everybody
bypass the rules. And now, that's why I would like to ask you this question, Daktari. What about our eyes, as people now who have no much information about how we should take care of them? What do we do now? Like now we are talking about eyes, and eye health. How do we carry ourselves so that we are able to take care of our eyes?
Yes. Now, eyes, I think, are the two most important organs
Yes.
in anybody's body. If somebody was asked, do we remove your eye or do we cut your leg? They'll always say cut the leg.
Yes.
You don't walk out of your house barefoot.
True.
But the eyes, you almost never think about them.
Yes.
Because they're just there.
Yeah.
But they are as easily at risk as any other part of the body from anything, including accidents. So one of the things that, one of the themes we had actually in the previous year, we have every October we have a day. We call it the World Sight Day.
Yes.
And our theme was Love Your Eyes at Work. The target was we need to look at how much we are at risk in our workplace.
Yes.
And one of the commonest things which can happen to anybody's eyes on the spur of the moment is accident.
Yes.
They are very common from things like stones, nails. Like a few minutes ago, I was just called by one of my colleagues that there is somebody who has come with an eye injury, likely from a nail. Maybe it was a carpenter. He was hitting a nail and it jumped and hit the eye. I have a child that came last week with an eye injury. Maybe they were playing. That's a very common thing. Children are playing the sharp things. So those are things that we have to look at.
Yes.
How do we protect ourselves?
Yes.
So I always advise, if you are in an activity or your job where there are moving parts, flying things, always wear protective eyewear. People break stones for ballast, for building. They should always wear, even if it's just simple 100 shilling glasses, which are sold in the streets, because that's what the stone will hit before it gets into your eye. And we get a lot of them. I think there is no month which ends without seeing somebody who was hit when they are breaking stones.
Really?
Yes. A very common injury. Mostly building industries where we have a lot of injuries. A second common injury is among boda riders. Because boda riders usually tie the luggage using a band, elastic band. Yes. And sometimes it can snap and it hits the eye. And most of them come with a very red eye, it's very painful, there is bleeding inside. Most of them come quite late and they end up losing the eye. Yes. A very common injury, and that is among bodas. But another worse one among boda is accidents, road accidents, where there is an eye injury are more common among boda riders, because when you fall in a boda, the first part of your body to hit the ground is your face, is your head, and so you can even hit something direct into your eye, or actually most of them have not only the eyeball, but the eyelids affected. Some even brain injuries, which can also press on the nerve which comes from the eye, and they end up losing vision. Wow. So generally, of course, we advise boda riders to wear helmets and just obeying the traffic rules about speeding, overtaking. They can prevent a lot of that.
And also wearing that protective, the helmets, which people really don't wear.
Yes.
A lot, eh?
Yes. So eye injuries are very common among children. Make sure they don't use any sharp objects. You should not even have access. And even nowadays, there is the trend, of course, in building to do open plan kitchens and so on. Always, if you have young children, either put a door somewhere or just make sure that everybody in the house, the house helps, know that all sharp objects to be kept away. Including forks, not just knives. And another accident I've noticed is actually being promoted by CBC, unfortunately, the new educational system, because it is advocating for a lot of children doing, physical activities.
Yes, helping in everything.
Yes. So some of them are being told, go make maybe this model, and some of those things involve cutting. And when you are
small scissors.
Even if the child has a parent to help them do that, they want to assist. Oh, let me help. They take knives. And sadly, last year I had a child, 6-year-old girl. She was making a model as advised us by the teacher. And she took a knife to cut a thread. Maybe she had stitched something. And she pricked herself in the eye. Yeah. So
Really?
yes.
Yeah.
So I've tried to talk to those I can access that please, as teachers, do not give assignments involving stitching,
Yes.
like now kushona nguo for kids as young as 10. Below 10 years, those are not people to give access to even knives or cook.
Yes.
In as much as we want to teach our children physical skills or life skills, we have to look at the risks that they are facing.
Might put themselves in.
Yes, and especially because even if they have parents, the parents may not be aware of the risks involved.
Yeah.
And because almost every 2 weeks I have a child with an eye injury.
Wow.
Yes, and they will always be with sharp objects.
Yes.
Sticks, knives that they maybe were either working with them themselves or they were left unattended by an adult.
Yes.
Yeah, so for every parent, when your child loses an eye, the effect is for a longer time than an adult. Because now there's something called disability adjusted life years. Somebody who loses an eye when they are 40 maybe have only another 30 years of suffering. But somebody who loses an eye when they are 5 years, they have the entire life. It might even change what they may do. They cannot be a pilot if they want, or some other career that needs 2 eyes. So that's why we need to be very keen about our surroundings.
Yes.
Personally, I even go and assess the school my child is going to study.
Yes.
How is the compound? Do they have kayaba fences which have sharp things?
Yes, very sharp thorns.
How are the fences? Is the compound full of rocks or sharp things that the children may pick as they play with each other, especially sticks?
Yes.
Be keen, because if it happens to your child, or your child uses a stick to prick another child's
eye,
then it means you might find yourself having
and once the damage is done, it's done.
Yes, it's very sad, because you can't sue a child, but imagine your child has been hurt by another child in school, for example. What do you do? And I've seen cases where the parent is like, I even asked the other parent to assist me and he told me it's not my fault, it's the other child's fault. What do you do to a child now?
There's nothing much you can do.
Yes, so prevention is always the best. Yeah. We did a study when I reported to MERU 15 years ago. We found in the year 2009, 2010, we saw 10,200 patients in the hospital, in the eye clinic. Out of those, 5,400 came because of eye problems. Of allergy. So that's the commonest problem, and I hope we'll have a session to discuss allergy by itself. And other than allergy, now in terms of seriousness, now we have the eye injuries, but we also have other common eye problems. There's one in elderly people, above 40 actually. Almost everybody above 40 has a problem reading things at near. Yes. We actually don't consider it's not a serious problem, because it's like universal. It's like the way you love wrinkles and you love white hair. But of course, when it happens, people get shocked. They are scared. I'm losing my vision or something.
Yes.
But we call it presbyopia, and that is because there is something in the eye called the lens, which is growing older. We call it the lens. So the older you grow, the harder it becomes, and it makes it hard for you to focus at near. So
you mean it's a condition?
Yes.
Yeah, I thought it's age.
It's age, yes, but it's a condition.
Okay.
And the reason we have to consider it is that we should never excuse anything and say this is age, so nothing should be done about it, so somebody should suffer with their problem.
Yes.
So when you find you cannot read the things at near, you need reading glasses. And they are very much available.
Yes.
So nobody should suffer because they can't read their Bible. That is the age where people want to read their Bible. They want to, the elderly ladies want to cook healthy food, beans. They cannot remove the stones because they can't see them. Or the other things you find in rice before you cook.
Yes.
So that's a common problem also. With that also is something called dry eye. People above 50, they produce less of tears than when they are younger.
Okay.
So they'll come complaining of burning sensation, gritty sensation in the eyes, sometimes tearing, and yet they have dry eye. And usually we recommend artificial tears. And also advise avoid the dust areas, wind areas, and so on to reduce that. So in terms of frequency, allergy, presbyopia, and dry eye are the commonest. But now there is another one, which is to me the worst eye condition you can have, that we call glaucoma. Glaucoma is terrible because it gives or it causes irreversible blindness.
What?
If you become blind due to glaucoma, there's nothing we can do for you. If you get other conditions, we can do something. But for glaucoma, unless we get you very early, we won't be able to help you.
Tell me, what is that disease?
So glaucoma is a condition where you have high pressure in the eyes. There is circulation of fluid within the eyes, generally to bring food. By food I mean glucose and oxygen to the eye tissues. And we have to use a fluid because we can't use blood. Blood is what does that in the rest of the body. But here we need something transparent, otherwise you won't be able to see. So that fluid enters the eye and it comes out. But in glaucoma, the amount entering is way more than the amount leaving.
That should be,
Yes, so there is a problem with the removal of fluid from the eye, eyeball. And now the pressure accumulating in the eyeball will press on the nerve, because where the nerve enters the eye is the weakest point. So the nerve will be pressed and it will start dying slowly. It doesn't happen in a day or two, it can take months to years. So by the time you notice there's a problem, because it's a painless process, it will be too late. Most people notice that they have glaucoma when they have lost vision in one eye.
Really?
Yeah, so by that time that eye is gone, so you have to scramble to save the other one. Yes, so glaucoma is such a serious condition that we recommend that everybody, actually there are studies which say everybody from the age of 25, but nowadays we've gone down to the age of 15. Everybody from the age of 15, whether you have a problem or not with your eyes, should have your eyes checked every 2 years.
Wow.
And not by an optician, sadly, because it has to be examined. The back of the eye, the inside of the eye has to be examined by either a clinician, that is a clinic officer, ophthalmologist, or an ophthalmologist, medical specialist, because they'll be able to pick glaucoma early enough. If it is picked early enough, you can be put on eye medicine, eye drops. You can
So
even
it's
undergo
treatable,
early enough, yes.
Before it's too late,
Yes, you can even undergo an operation and you don't lose vision. So that is the most crucial, that everybody above 15 up to age 40, eye check-up every 2 years.
Wow.
After 40, every year.
Oh.
Yes. Whether you have a problem or not,
just
go have your eyes checked inside. You are told you are normal, see you next year. Because when that happens, I've seen people who were diagnosed with glaucoma 15 years ago, or ones who I diagnosed myself 15 years ago, and we put them on treatment, eye drops, and they're okay. And I've seen people who say, they lost their eyes 2 years ago, and they did nothing, and they come and they are blind. So glaucoma is very common. I think every week I get up to 10 patients with glaucoma.
Here in MERU?
Yes.
Oh
and
my God.
Sometimes I just have to tell them it's too late, we can't do much. And the other thing is glaucoma is a family disease. So it's very possible to get grandfather with glaucoma, father with glaucoma, son with glaucoma.
What?
Yes, so if you have a relative with glaucoma, you need to be checked. Actually, every time I see a glaucoma patient, I examine whoever is coming with him, the relatives, maybe the children, and I always tell them, if it's an old person, every time you come with your child, If you have 5 or 6, whatever number of children you have, every time you are coming, come with one of them, a new one. I'll examine them for free. Yes.
And this disease is that common here in our county, yeah?
Yes. Glaucoma in the whole world, there are over 80 million people blind due to glaucoma.
And there's no way, how can we tell?
You can't. That's why you have to go and see a doctor to be checked. You can't tell you have glaucoma, you don't. So when the doctor examines you, they check your retina, they tell you, and maybe if need be, they can check the pressure in your eyes.
Yes.
They tell you you are okay or you are not. If they suspect you have glaucoma, even if the pressures are normal, they can send you for a test. Luckily, before we used to send people to Nairobi for that test. We call it a visual field test. But 2 years ago, we got the equipment at MERU Level 5 Hospital. A machine which costs over 5 million shillings. Yes. But we only charge 2,500 shillings for the test. Yes. So I may examine you, I find signs of glaucoma, maybe I'm not 100% sure, so I send you for that test.
Yes.
And then it will tell me, yes, there's glaucoma or there is none. If there is glaucoma, start you on medicine. Yes. Then we may check you regularly. If we find the medicine is not working, we start with maybe a lower type of medicine, we go to a higher one. If none is working, because we'll be monitoring with your pressure and that same test, then we can even do an operation. All of that is available in MERU.
In MERU.
Yes. So nobody should lose vision to glaucoma. Everybody should just, that's the other thing, other than protecting your eyes, is you should have an eye checkup. Yes. Depending on your age, either annually or every 2 years.
Every 2 years. Now, you have heard my viewer that the eyes are quite special. They're unique in their own way because they are doors to our lives. They help us move and work and be. I would like us to take a break, but even as we take the break, I'd like to hear your views on our program, on our segment today on the eyes. I'd like to hear more of your questions. Send them on the number that is on your screen so that we can continue. We'll give them to the specialist and he'll continue answering them. Welcome back, our viewers. Very interesting to learn about eyes and to see that even eyes, as much as we think they're just kawaida, we need to really take care of them. So I want to welcome back Daktari and welcome you back, our viewers, so that we continue talking about eyes. Karibu sana, Daktari. Tell us, I'm interested now, Daktari, I want to know, tell us more about your clinic at Level 5. Because I hear you people have a very beautiful clinic with very good equipment. Tell my viewers what is available so that now people stop running to Lions Hospital in Uganda, in Nairobi. I mean, let us help our people know what is available in our Level 5. So
MERU Level 5 Hospital is actually the referral eye center for Upper Eastern, especially, but luckily for us, we have more doctors nowadays. Yes. Before we used to be the only place with an ophthalmologist all the way to Marsabit. No. But for the last almost 8 years, we have had ophthalmologists in Siloam. So it has really helped reduce the workload in general. We have an ophthalmologist in Chuka.
Nice.
Yes, and of course, Nanyuki, there was one, but I think not now, but I'm sure they are getting one very soon. Yes. So we still are the biggest in terms of numbers handled because the MERU County is the largest in population in the region. Okay. So at the moment we have one ophthalmologist, but another one is joining us in the next 2 months. So the workload will be shared. We have visiting ophthalmologists. There's one working with an NGO who comes to help almost every week, specifically patients being seen in the field. Yes. There's even a pediatric ophthalmologist. That one deals with children. That is an ophthalmologist who has gone further to train about how to do, especially surgeries for children. Those are quite delicate.
One in MERU now?
No, we don't. Hopefully we will in 2 years' time.
Okay.
But there's one who visits every quarter, like every 3 months. And she gets a lot of work. Maybe she'll come and operate up to 30 or so children.
Those are many.
Yes. So we are able to do more than we could a few years ago. In terms of equipment, we have that machine we call a visual field test for glaucoma. We have another one we call OCT for checking most conditions, including of the back of the eye, retina, and so on. Very expensive machines. All of them were donated by an organization known as CBM.
Yes.
CBM means Christian Blind Mission. It was started in Germany over 100 years ago. Yes, so, and they have done a lot. They sponsor trainings. They sponsored my own master's training.
Wow, that's nice.
Yes, so they have really done a lot for Africa generally. Yes, so we also have a machine we call a YAG laser machine. That one is for cutting a membrane which may form sometimes after an operation from cataract. Cataract is another condition we have where people lose vision, mostly due to age, but it can also happen in children. Like now, the pediatric ophthalmologist comes to operate cataracts in children.
They are there. I thought cataracts are for old people. Though I don't know
commonly.
much about them.
Maybe 90% of the cataracts out there are in the elderly people.
Yes.
But you also have a number in children. And the ones in children should not just be touching now. They are very sensitive. As we said, children have many years of disability. So now the pediatric ophthalmologist is the one who handles those ones. For the adults, the rest of us operate. Even the clinical officers operate. We have at least 5 people in MERU County who operate cataracts, based in MERU County. Clinicians and ophthalmologists. We are 3 ophthalmologists in the county. I am the only one in the government hospital. The others are working in the private sector, including the one who visits from to help with the county. So we cannot do the adults. Yes. But the children, to get a specialist coming. Yes. Okay. So, but when you have a child with any of those, don't wait for, you come, we book. If you need to see the specialist, the subspecialist, because you are a specialist, but that one is a subspecialist, we book you for her to see you. Yes. So, in terms of equipment there, in MERU General, we can do most of the common operations, injuries, like now I have around 2 injuries I have to handle this week, and some cataracts, and some other minor operations. We operate at MERU level 5. There are some we can't operate here, we have to refer.
When they're so bad,
especially conditions involving the back of the eye, the retina, we don't have the equipment to do that. It is very expensive to set up, over 100 million to set up for that. And even if we did, the numbers don't justify. Yes. Luckily, we have, they can be operated. There is a center at Nyeri with a bigger branch, or the original headquarters is in Nairobi, where we send most of our patients. Yes. So it's called City Eye Hospital. They have a branch in Nyeri, which is nearer for some of most of our patients. So the ones we can't handle, retina mostly, we refer.
You refer them there.
Yes.
Okay.
But nobody should say, this is not possible to do in MERU. Let me either stay with my problem or let me rush to Nairobi. Yes. Yes. So always come. And the good thing is, apart from MERU level 5 hospital, we have especially clinical officer. We have one in the hospital in Nyambene, and I think more will be coming from training in the course of this year. And then we have ophthalmic nurses who are also able to diagnose most conditions, and we have them in Miadhene, in Githongo, in Mudara. Those are sub-county hospitals. Yes. So people can make use of those institutions. They should not rush to optical shops when they have a problem. I had a young girl, 20-something years of age, who has been treated very severe allergy in an optical shop for years. And the eyes are almost getting ruined. Because that is not the right person to treat allergy. That person is very important for glasses, and it's not like we don't want opticians to have work. Yes. Because their work is plenty. as you said, there is now the other, what you call refractive errors.
Yes.
People who are short-sighted, people who are long-sighted, because if we say out of 2 million people in Meru County, around 400,000 are people over 40.
Yes.
All those people need glasses.
Need glasses.
Who will give them?
Yeah.
The opticians. That's work for them. Also, there are lots of allergies. We also give glasses in those cases sometimes, but let them not give medicine. Let them give glasses.
Glasses, eh?
Yes.
You say optical shop. It's good to explain that you mean the shops we see in town selling specs.
Yes.
That they are not the right places to go and be treated for any eye condition.
Yes.
Yeah, you must see a doctor first before you run and be treated there. Go to the government hospital and see a doctor.
Yes.
Yes. So when you say optical shops, I'd like for you to, some people might not understand when you say optical shop.
Yes.
Yeah.
So opticians, most of the time it will be written optician.
Yes.
So the only times I would advise anybody to walk to an optician as a primary place is if they can't read something at near or they can't see far. That is something that and some opticians will even be able to pick glaucoma and refer you, which also you may not be able to see. But ideally, you should first see a doctor in any situation, and then they send you to an optician.
To the optician, eh?
Yes. But you know, most people know optician is the eye doctor, and that is not the case.
That is not the case,
Yes.
yeah? So like this girl you're talking about, she would go to the such a shop and get treated.
And they would give her medicine. Now, before, there's a drug that I need to mention because of how dangerous it is. It's a drug called Probeta N.
Yes.
Probeta N is a combination of two drugs. One is a steroid called betamethasone and an antibiotic called neomycin. That antibiotic is very dangerous for the eyes. It is a drug which in the 80s maybe was useful to treat some infections. But at this point, all the infections are resistant to it. So it's almost useless.
Okay.
But now it reacts when you use in the eyes. And then there's
it's very common, it's everywhere.
Yes, it's a drug which costs less than 100 shillings.
Yes.
So even the mama in the village knows about Probeta N because it was so available. The other component, the steroid, betamethasone, is a very dangerous drug to use anyhow. We use steroids a lot, but we are always examining them before we give a steroid, and we monitor. When we give a steroid, we have to review the patient because of the danger of the drug. But now everybody gives them like peanuts all over, and we get a lot of people coming. If you are given Probeta N and maybe your problem was just you had an infection, it gets worse, or something entered your eye. And I've been in this county for 15 years. I've removed over 200 eyes because the eyes were perforated because of using Probeta N.
Really? Yes. Oh my God.
So we highly recommend don't walk to a chemist or even to an optical shop if you have a problem, you want medicine. Because most people actually have no training in eye, even the people in the chemist. So they just give you what they commonly hear about. And they'll give you Probeta. I've even had people being given Probeta N by medical people, especially in the periphery, in the dispensaries and so on, because they have heard of it. Yes. And you always tell people, when it comes to eye, you get an eye injury, try to ask, where are the eye doctors? Like now, when people have dental problems, they don't just walk to any medical place. They always know that dental doctors, dentists, are different kind of doctors. So they don't just go to anybody. And most clinicians who are not dentists, no, that's not our area. Yes. So you come to us, I have a tooth problem, go look for a dentist. Go to the dentist, actually. Yes. Now the sad thing with eye is that everybody thinks they can do something. You go to a general clinic officer and they want to treat eye. You go to a general doctor and they think they know about eyes. Exactly. Then now we have very negative results. Yes. In fact, even specialists who are not eye doctors, we have seen them give the wrong medication. If I'm a pediatrician, I have no business treating eyes. Yes, it's a child who has come with allergy. I need to refer. Just like I am an ophthalmologist. If you come with you have diabetes or something else which is not my field.
Yes.
Even
You
if I have
to
an idea about it, because I studied in the undergraduate,
Yes.
I won't treat you. It's not
it's
right.
good.
I refer you to the pediatrician or to the physician to handle that. Because
So eyes are sensitive, Daktari. We need to understand that.
yes,
Eyes is not just any part of the body. We need to be careful how we treat our eyes.
yes,
To see to anywhere, and we expect we'll get well.
yes. So as in, even as a patient, you need an eye doc. You have an eye problem. Don't just go to any doctor. Ask for who are the eye people. Yes, don't just say any doctor can handle this.
Yes.
There are those conditions, like in our training. Let me give an instance how we trained, for example, in the University of Nairobi, where I was. If you spend out of maybe in 1 year, you are supposed to rotate in various departments. You may spend 3 months studying about surgery.
Yes.
About even operating maybe major operations.
Yes.
You may spend 3 months studying pediatrics,
Yes.
children's diseases, malaria, pneumonia, all that. 3 months gynecology, delivering babies, other conditions of pregnancy and so on. But eyes, just 2 weeks. So that is not enough time for anybody to come from school and feel they can treat eyes, even as a general doctor.
Yes.
When I finished my training as a general doctor and I was sent to Turkana, and I could handle most conditions.
Yes.
But when it came to eyes, I see you have an eye problem, I have to send you all the way to Kitale to see an eye doctor, because I knew that 2 weeks was not enough for me to treat.
Yes.
2 weeks was enough for me to be able to tell what is an emergency, what is not.
Yes.
And that's why we always, even when we are training, we train them how to identify major conditions,
Yes.
not necessarily to treat them, maybe basic first aid, and then refer.
Yes.
But if I come from school and I want to treat everything in an area where I only spent 2 weeks,
2 weeks, it won't work.
it is dangerous to the patient.
Yes.
Yes.
And why are eyes so sensitive? Why are they? You know, they are very delicate. Because, I mean, they are part of the body, but why are they so delicate?
Well, that's how we were created.
Yes.
And even the Bible says something about the eyes being the window to the or the light to the body.
Yes.
So I think they are just special that way.
Yeah.
And some people use the eye to actually explain the creation.
Yes.
They say it is almost impossible to explain the evolution of the eye.
Yes.
The eye is actually made up of 3 different tissues forming together in a very specific manner. Wow. When the baby is growing in the womb, we call it embryology. You have 3 tissues. There's what we call the neuroectoderm, there's something called surface ectoderm, there's mesoderm. How those 3 come together is just not something random. So they are just that special. But generally the special senses, the hearing, the taste, the smell, the eyes, they are called the special senses. They are just unique. They are not things that can be explained. And that's why some in the lower forms of life, there are some of them are missing. Yeah, but
what do you mean in the lower?
like for example, we can't say how do maybe snails sense, or do they see? We can't explain a lot of that.
Yes,
I mean,
by
the plant, insects, etc. But when it comes to eyes, an insect has even, like a fly has hundreds of eyes, compound eyes.
Yes.
So that's why I'm saying eyes are the most, that one is what tells this thing was created by somebody intelligent. Yes. It was not accidental.
They're quite unique and special in their own way.
And that's why in a fly, of course, the eyes are one of the biggest
part of the body.
Yes.
They carry the biggest part of the body.
Yes, they might even be bigger than the brain in the fly.
So it's true when there's somewhere I read that eyes take like 50% of the brain, or 50% of the human brain helps to look or helps in sight. Is it true or?
Well, in human beings, not so. Most of the brain is actually for other functions like standing. I mean, for us to be straight, we had to have the family called the cerebellum, which makes that possible. A lot of the brain is also for higher functions like thinking and so on. But the brain, the eye, vision has a part, we call the occipital cortex, in the back of the eye. Actually, I've had a case where somebody had some bleeding in the back of the eye due to an injury, and they lost vision. So
Completely.
yes, there's a, because everything you see is, the eyes are just like a camera. They take the message, which has to be sent to the brain for processing. So if there's a problem in the brain, the eye will not see. Yesterday, I had a patient who couldn't see, but it wasn't because there was anything wrong with the eyes. It was the brain. There was something pressing on the nerve in the back of the eye. So that one would kill the nerve, and they lose vision. So, and that's something that a doctor would pick by examining you. We have all the machines for that in the hospital. And then we send you for a scan of the brain, which is also available in the hospital, as well as a few private areas. And then we see what your problem is. And you are sent either to a neurosurgeon. When it's behind the eyes, now we send you to a neurosurgeon. And we have a neurosurgeon in MERU also.
Wow.
So MERU actually nowadays has almost every kind of specialist. So the cases we refer to Nairobi are for subspecialists. Those are now, subspecialists are usually very few in the whole country. You might find like now those pediatric ophthalmologists, there are less than 10 in the whole country. Because of course the numbers are also that few. So you train so that you have a specific thing you are doing. So you must have the number. If I train as a pediatric ophthalmologist to be based in MERU, I may not really handle many. I might have to work in several counties to make that happen. Like now, glaucoma, you can subspecialize in glaucoma only. Yes, that's one disease. In fact, there are only 2 diseases in the entire body that somebody can just go back 2 years to study just that one. One is diabetes. Yes, there are doctors who have, after you do your master's in internal medicine, you go back and specialize in diabetes. Because diabetes can affect everyone, including the eyes. Then the second is glaucoma.
This glaucoma thing,
yes, because of the danger. Now that's one specialty. Then there's a specialty of cornea. Cornea is the front of the eye, where you can do cornea transplant. Cornea. Yes, actually I have
you transplant and give someone another one.
Yes, from a dead person. I trained in that one abroad in Italy, but because I didn't want to leave MERU, I don't get to do it. If I was in Nairobi, because you don't have corneas. Otherwise, it's something very simple we could do here.
So do you go harvest them from dead people? Do people agree, or people have to sign to agree?
Yes, the relatives, because the person is dead. But you can harvest from them and use those corneas in up to 4 people.
Do you get people agreeing to do it?
We don't have a cornea bank locally. We have one in Nairobi, which is under Lions Hospital. So we are not able, it's not really doing much. They do, but they get very few, mostly from Asian community. Most of the corneas in Kenya are imported for people who need surgery. A cornea transplant will cost up to 400,000. Because the landed cost from maybe India or America will be almost 200,000. But now the hope is we can get cornea banks, because everybody has a cornea and they die with them.
And they are buried with them in something that can be used.
So cornea is a specialty by itself. There are people who specialize in retina. The back of the eye is called the retina. That one is another 2-year training just for that. Yes. That is after the degree, the masters you did, you go back for another 2 years. Then there are doctors who specialize in what is called orbit or oculoplastics. If you have, maybe your eyes are drooping, you can't open them well, or you have eyes protruding, you have a tumor behind there, there's a doctor for that. Those ones, we have around 4 in the country. That is the least populated. And then of course you have the pediatric ophthalmologist. So we have all those areas where I'm a specialist, but I still have to refer them to another senior specialist to me.
Okay.
Yes.
And Daktari, what is your parting shot as a senior eye doctor for us, for my viewers who I know are listening so well?
Well, 80% of blindness
Yes.
is preventable or avoidable or reversible.
Yes.
So if we are just keen on loving ourselves, loving our bodies, we will not get there. We will not get any of this blindness. We don't get any of these conditions which make our life really unbearable. So all we need to do is actually to love our bodies, because this is the biggest asset we have.
Yeah.
Our bodies, our eyes are a very big asset.
Yes.
So we give it the attention. We don't feel. I've had a patient come one day and they were told the consultation to see me then was just 1,000. Like, just for an eye, 1,000. You know, that tells you this person doesn't value eyes as something worth of attention.
Yes.
But they are very crucial, because you might have a very healthy body, but without your eyes, you won't be able to reach your
To function
potential.
much, yes.
Yes. Yeah. So love your eyes. That has been our theme for most of the last year, and you'll be able to solve most problems. There are some you can't, but most of the ones that are there, if you just a few keen things and you prevent them.
Well, my viewer, you have heard, this is such a unique topic of all the topics that we have done, because most of the time, the way you're viewing us now is through your eyes, but how are you taking care of them? As we continue to learn about our eyes, let us be keen, let us wake up and go to the hospitals and have our eyes checked so that we can have improved health, so that we can do well in our daily businesses. Remember, it is your body that is serving you most of the time, and unless you can see, there is not so much you can do. So as we end our segment today, I'd like to encourage us to really take care of ourselves by making sure we make use of our doctors who are available to us. Especially in this county, you've heard that we have a very good high clinic in MERU, level 5 hospitals, and in the sub-county hospitals as well. So don't sit there and stay without seeing a doctor and getting help for yourself. Thank you very much for watching us. Thank you very much for staying with us this evening. Good night.